Watch your mouth.
All right, we're here with a new segment here on HTV with our own dental expert. His name is Dr. Ryan Walker. Doc, good to see you. How are you?
Doing great, Martin. Thanks for having me.
Moms get more involved in their children's teeth, or is it the men? Probably moms, right?
Probably going to be the mom. Yes, sir.
The most common threat to someone's teeth, what would it be?
So no surprise is going to be cavities, right? The most common threat is going to be loss of tooth structure or decay or cavities. And that's important because once you lose your baby teeth and you get your permanent teeth, that's it. That's all you're going to get. You got to make those last the rest of your life. So this is with some tooth erosion or cavities or tooth, structure loss. That's erosion right there. That's from acid. That's from acid. That's dissolving tooth structure from acid in the mouth. That's what sugar decay looks like right there.
I thought sugar was the biggest reason for cavities and all, but you just hinted that it might be something else.
For whatever reason, they think that sugar has been demonized and sugar is really the biggest threat to your teeth. Mm-hmm. It's actually not. It's actually acid. So sugar by itself poses no threat to tooth structure.
How do you know when your mouth is too acidic?
Acidity is measured by this scale right here. It's called the pH scale, right? So 7 is neutral, 14 is the most alkaline, 0 being the most acidic. So what happens is, as your mouth gets to be more acidic, right below at about 5.5, that is enough acidity to start causing loss of tooth structure. That's where your tooth is going to start to melt away. We drink a good old Coca-Cola with an acidity of 2.4, right? So that's pretty acidic, well enough to demineralize tooth structure. Take this guy out here, Dr. Pepper, 2.9. Very acidic enough to demineralize tooth structure. So, people's diet, they say, well, I'm going to cut out the sugar, I'm going to Diet Coke, right? Doing better for myself. Not really, because Diet Coke is a 3.1.
Wow.
So not really much better. Still very acidic. Okay, we're cutting out Coca-Cola. We're going to, let's say we're going to just start drinking some good old Gatorade, right? Some sports drinks, they call them. Well, guess what? There's really not much difference between a Gatorade, a Powerade, all these sports drinks, and a Coca-Cola. Here's a popular one. Good old energy drinks, right? Monster, Red Bull, whatever you drink, and guess what? It's the same. Well, I'm gonna quit drinking all that. I'm just gonna sip on some juice. Whether it be any juice, it doesn't matter the type of juice. Still, ton of sugar and enough acidity to demineralize tooth structure and melt away tooth structure.
We are surrounded.
All right, we're getting healthy. We're gonna drink some good old LaCroix, Topo Chico, some good flavored carbonated water. Guess what? Right, we're still acidic. What can we put in our mouths that's not acidic, right? We're running out of stuff to drink. So milk is 6 to 7. Plant-based or regular dairy milk, it's 6 to 7, so that's not gonna cause any damage to tooth structure. It's not reality to think that nobody's gonna drink this stuff, right? That's not a reality, and you can drink this stuff. It's a matter of how you drink it. The body wants us to be here, and then every time we eat or drink something, acidic or non-acidic, just a carb, a fermentable carbohydrate, a sugar, what's going to happen is it's going to push the mouth down here, right? Mm-hmm. So it's frequency.
So if you work at a place that you have access to a soda machine, you could be in trouble.
Teenagers or college kids that work at fast food places or anywhere you have access to a fountain drink machine, right? If you have access to it, you're going to drink it. And I see a lot of decay in young adults.
Relationship between saliva and dry mouth and all that.
The body wants your mouth to be neutral, right? So every time you eat or drink something, it's going to push it to be acidic because, I know we said that, sugar is really what gets demonized, but it's actually acid that's a problem. Mm-hmm. So when you feed the bacteria sugar, it's going to make the mouth more acidic. But what happens is after a meal, if you have normal saliva function, the saliva is going to want to push the mouth back to neutral. That's where we see problems with people that have dry mouth having a lot of decay because their saliva function, whether that be from medications, you know how many medications people are on these days, through medications or through some other problems with the body, you don't have normal saliva flow. And if the saliva can't function, you can't get your mouth back to a neutral pH.
You don't see a lot of things in the drugstores that you could take to correct that. Do y'all have solutions for that?
Right. So there are solutions, but you're not going to find them in a drugstore because nobody realizes that this is what's going on in your mouth. Nobody realizes that an acidic mouth is the problem. So all the stuff in the stores, fluoride's a big one. Mouth rinses with fluoride. Make sure it's got fluoride. It doesn't really do any good in an acidic environment.
I see some test strips over there, and I'm curious as to what
Right.
that's all about.
So if this is a problem for you, if you're just curious about it, or if you go into the dentist and you have cavities every time and you think, man, I've done everything I can, let me see what's going on. One really easy thing to do is there's pH test strips that are really inexpensive, and you test your saliva. Right? You can test your saliva and see if it's acidic, see when it's acidic, and try and get a handle on the problem if this is a problem for you. You can't escape it. It's there. I mean, it's always there. It's just a matter of how you drink it. It's the frequency.
I look forward to seeing you again. And once again, this is Dr. Ryan Walker, our dental expert on HTV. And watch him on Facebook and YouTube. We're going to have him on every week with some kind of tip. So very interesting stuff. Stick around for the next one.
Watch your mouth.